Thank you. Senator Whitehouse.
Thanks very much, Chairman. Thank you both for being here. Mr. Andres, let me start with you. One of the predicaments that the minority party often has is to get answers from the executive branch. Actually, it's a problem that is often shared by both parties in Congress. I'm wondering what assurances you can give me that you will be responsive to questions and queries from senators, irrespective of which side of the aisle they sit on.
Senator Whitehouse, thank you for that question. And if I could just add in the beginning, I want to say how much I've enjoyed working with you when you were the chairman of the Budget Committee, and I was working on the House side for that. So I also know from the meeting that we had together how passionate you are about some of these issues, particularly CMS payment issues for your hospitals in Rhode Island and neighboring states.
That's exactly why I want to make sure you'll take my calls and pass my questions through.
I'm very well aware of that. You made your point very clear. So thank you for that. And I will say, and I've said it before, I bring to this potential job, if confirmed, a commitment to work with both sides of the aisle to be accountable, responsive, and timely in our responses.
I appreciate that. Mr. O'Neill, how many cases of measles is okay in the United States?
Senator, measles is never okay.
How many deaths from measles is okay?
Senator, every death is one too many.
So is there a number of cases or a number of deaths that would cause you to reconsider whether the present HHS strategy is working versus failing and cause a reconsideration of the present strategy? Or are you just going to follow this however it leads, however many cases, however many deaths?
Thank you for the question, Senator. I am concerned about the outbreak of measles. I think the best way to prevent a further growth of measles is the MMR vaccine, which I've received myself. I believe the MMR vaccine is safe and effective. And the Secretary has said the same thing. He has recommended parents give it to their children.
The numbers continue to grow is the problem. What somebody believes is one thing. It's the effect out in the population that really makes the difference. Is there a point in this trajectory of worsening measles cases and increasing deaths where you think a rethink of HHS's present strategy would be appropriate?
Senator, the Secretary and the Department have recommended the MMR vaccine. If there are other reforms that you think they should be taking, I'd be happy to hear about them.
Yeah, well, it's pretty much of a mixed message on the vaccine as best I can tell. So let's move on to another topic, which is the Musk, Doge, Doggy, whatever you call them people, have had access to HHS data sets, have they not?
I don't know, Senator.
All right, when you get there, if they have had access to the data sets, will you support doing an audit of the data systems to make sure that if they've been harmed, those harms are corrected? If there's been exfiltration of personal data, that is acknowledged and remedied. And if there are back doors that have been left in for private sector access to data systems, that those will be remedied as well.
Senator, I'm a strong advocate for medical privacy, supported the passage of the HIPAA law in the 1990s, supported the promulgation of the HIPAA privacy rule in the Bush administration. I think medical privacy is both an important legal principle as well as an important moral principle. Patient data should never be abused and never viewed by unauthorized parties.
So will you look at those questions to see if it has been?
Absolutely, I will, Senator.
Great, thank you. The last point, Rhode Island wants to be a model for end-of-life care. There are very stupid things that exist in the present system. For instance, if you're dying and the family needs to have you go to a nursing home, there's an intermediate 3 days and 2 nights you have to spend in the hospital, which creates nothing but drama and added cost. If you need respite care, the respite is that an ambulance comes to the house, and with all the drama of gurneys and all of that, Granny gets dragged off to the hospital where it's very expensive, and it's hard to feel that the family got a whole lot of respite when they've subjected their loved one to that. Instead, you could just have a nurse or a social worker come into the house and help solve the problem of respite. So there's another flaw in the system for people at the end of life. And then palliative and medical treatment ought to be able to go on at the same time. We are eager to work with that. I mentioned that both to the secretary and to the administrator, so I'm just mentioning it again to make sure that it's in your consciousness as well. You just said states could be laboratories. We want to be one. And the existing system for the treatment of people facing the end of life is not humane, not wise, and not cost-effective. So look forward to working with you on that if I can get the organization's attention enough to work with me.
I love the idea, Senators.
My time is up. Thank you, Chairman.
Thank you. And Senator Wyden has one more brief.
Senator Crapo has to get to vote, and I'm going to be very quick. Mr. Andres, you got a lot of chutzpah. I heard Senator Blackburn ask you about bipartisanship, and you named a number of things, including the PBM legislation, which I wrote with Senator Crapo. Do you know how that got derailed? At the end of the year, Elon Musk, backed up by Donald Trump, objected. We had it all ready to go. So do your best to get the facts right and get your bosses to help us on things that are truly bipartisan, like that 26-0 vote. Thank you, Mr. Chairman.
Thank you, Senator Wyden. And we do plan to get that legislation over the line this time and look forward to the administration's help.